Hello, everyone. Welcome to Meditales with the Portatile Doctor, where I will review the accuracy and realistic feasibility of medical contents found in scripted and unscripted works, such as movies, TV shows, adverts, novels, and books to facilitate public health education. Don't forget to visit our website and blog today. So, moving on to something exciting, we will be reviewing. Can I get some drum rolls, please? Unroyal, a 2020 Nollywood movie, directed by Moses Inwang and produced by Matilda Lambert. Now we draw attention to scenes surrounding Princess Boma's accident and care in Dr. Toby's hospital. Now, about the onset of drug effect. The movie showed that she was drugged with 3 tablets of ecstasy that had been administered in her wine, served in a glass cup about two-thirds filled. The apparent onset of the drug effect, that is alcohol mixed with ecstasy, was immediate, which would unlikely be the case in reality. Ecstasy, when taken orally, takes about 20 minutes for their effect to become apparent. However, this may be shortened when taken in combination with alcohol. One might argue that in someone who had not had prior exposure to psychoactive substances such as these might manifest symptoms earlier, but that is arguable. She appeared to experience a sudden continuous severe headache and significant discomfort as her main symptoms before the accident. Now, 3 tablets of ecstasy in someone who has not had a prior exposure to it can be considered an overdose, and this would have manifested with myriad of other serious symptoms as well, which was not demonstrated. Now, she managed to get into her car and drive out of the compound, albeit quite cleanly, for someone who was overdosed. Now, the screeching sounds of the car might inform the audience that, oh, the driver might have lacked some level of control and she was said to be speeding, but the distance was short between where she left and to where the accident scene took place. Now, they didn't do justice to convince us about the resultant severe injury that she suffered. Now, the screeching sound from another vehicle at about 90 degrees to her car in an adjacent street. We cannot appreciate speeding from the view of the oncoming car, and this leads to a collision. We can't really appreciate the severity in which she is hit from the left rear of her vehicle, prior to which she screams and subsequently loses consciousness. The viewers do not get to see the level of impact to the colliding cars to justify the severity of the injury proposed to have occurred. Now, we don't get to see the scene following the traumatic event and how she was conveyed to Dr. Toby's hospital. And we can see that she is wheeled on a hospital gurney in a hospital corridor to the theater by a doctor and some nurses. She is still unconscious and has blood smeared on her left side of her face. She apparently has no other reported injuries, despite the alluded severity of impact that had landed her in an apparent critical state. Now, at this point, a doctor's evaluation is missing from the movie, and the viewers don't really know what working diagnosis is being considered. It is difficult to justify the need of an urgent surgical intervention that had been planned for this character in this movie. Is she unconscious due to a severe head injury from the impact of trauma? Then she would have had a cervical collar in place and neuroimaging done. Is it due to narcotics overdose? Then she would have had an intravenous access and at least intravenous fluid and other forms of resuscitation to counter the effect and the toxicity of this medication. But we can't appreciate any scene of a resuscitation going on. Now, is it from a blunt chest trauma with cardiovascular compromise that has led to a brain injury? We really don't know. But we can appreciate the sense of urgency and appreciate that her condition is critical. It is uncertain what the doctor was trying to achieve by palpating her abdomen. Are we suspecting a blunt abdominal trauma? Well, but she's fully dressed and she's wheeled to the operating theater. If it was an attempt at a patient examination, then this has been done quite poorly. Now, in the operating room, Princess Boma is now on the operating table. However, her head view is not clear to appreciate whether she has been intubated for the surgery that is about to commence. The sound of the monitoring devices and the mechanical ventilator is heard, but the monitors appear not to be in use, as the monitoring parameters are flatlined, which does not reflect the status of the patient as she is still quite alive. Someone is on scrubs at her headside, who may be safely assumed to be the anesthetist for this scheduled emergency surgery. A lady scrubbed near a table containing some instruments can be safely assumed to be a theater nurse, who is ungloved. She is seen to cut a plaster and hand over to another lady's scrub that has been gloved, later learned to be one of the operating doctors. One may wrongly guess that the plaster was used to help the anesthetist because at this point there is no diagnosis, and at no point was the type or nature of surgery mentioned. Dr. Toby enters the operating room and recognizes the patient. He then uses his right hand to pull down his face mask for viewers to see that he whispers the patient's name before requesting for a pair of gloves to start the surgery. A lot of things are wrong with this scene. Asepsis in the theater. This was not adhered to by the operating doctors and theater nurses vis-a-vis their wear and their actions in the operating theater. Inappropriate props. The gloves used in the theater appears to be conform and not of the surgical type, which is sterile. The manner in which they were worn shows that they were not properly guided, vis-a-vis hand care in the operating theater, appropriate hand glove use, nature of application of hand gloves, amongst others. Disposition of the operating team. The first doctor that had contact with this patient is now seen to have handed over to the operating doctors. Between the two operating doctors, it is unclear who the lead surgeon is. One might assume that the female doctor is the lead surgeon as she is positioned at the side of the injury and the discussion that later ensues in the scrub room. But then, surgery does not commence until Dr. Toby arrives, hence the ambiguity. In reality, it is unlikely that the first doctor to review would not hand over to the operating doctors properly and not be part of the operating team in such a scenario. However, exceptions do exist. It is apparent that Dr. Toby has not reviewed this patient because he is just identifying her while on the operating table. If he was contacted about this case prior to arrival, it is not known, nor is it shown. It is unlikely that an operating surgeon would not familiarize himself about a patient's clinical condition prior to operation, either in the notes or by clerkship. Now, this helps in preparedness and avoidance of anticipated challenges or medical errors. The expression of awe may still be displayed when an operating surgeon sees the clinical state of a critically ill patient. It was inappropriate for Dr. Toby to pull down his face mask when he does not plan to scrub again. The way in which he wears the requested conform gloves, which is also inappropriate for the occasion, shows he has not been properly guided. Viewers don't get to appreciate any surgery being done. It would have been good to get some operating action if a theater scene was used for such a critically ill patient and a surgery was anticipated. Now, in the scrub room, the two operating doctors are seen washing their hands in the scrub room, but no antiseptic detergent is seen. A discarded glove is seen at Dr. Toby's side of the scrub sink. This should have been properly discarded and not left in plain view. Dr. Toby's difficulty in removing his hand glove is also displayed again. Is it too tight or a lack of technique? It's hard to tell. The post-operation discussion is kicked off with Dr. Toby inquiring from his female colleague the chances of patient survival. Viewers can easily assume that the female surgeon is the lead surgeon in this case, based on this inquiry. She, however, notes that the patient is high on narcotics and would need prayers as an intervention. In reality, such submission would be difficult to entertain given the paucity of preoperative patient evaluation and testing. More so, the couples involved as well as the patient have not volunteered such information. No discussion about the surgery done, technical challenges, and envisaged post-operation care is displayed. This is unlikely to happen in reality. Now, patient relatives in the waiting room and feedback. The room is crowded with Princess Boma's family, their servants, traditional council members, securities, etc. The first doctor to review her on arrival to the hospital is seen to bend forward while communicating to Princess Boma's father. One would guess a feedback on care is being done. This location and method of communication has been done rather inappropriately. More so, the operating team is not seen to give feedback, which is unlikely in reality. Feedback ought to be done in confidentiality and in privacy without the crowd that is not the patient's direct next of kin present. Now, in the intensive care unit, Princess Boma is seen to be nursed in the intensive care unit. She is intubated and mechanically ventilated. Infusion pumps and monitoring devices are present. However, it is difficult to appreciate their connection to the patient, aside that of the pulse oximeter. The patient has an extensive plaster on the left side of her face. She has in place on her right hand a blue intravenous cannula inappropriate for her age. Blue intravenous cannula is appropriate for children and not for adults. Now, the fluid is ongoing, but we cannot appreciate that this fluid is actually being administered to the patient. The patient's appearance further emphasized that she was not properly prepared for surgery as she still has artificial eyelashes and her painted fingernails. Now, Matilda is not allowed to visit Princess Boma in the intensive care unit, which would likely be the case in reality because the intensive care unit has a significant restriction to visitors in order to maintain to maintain avoidance of unnecessary contamination and bacterial infection. The disposition of Dr. Toby is appropriate in this scene. However, it would have been good to also assure Matilda that the managing team was doing their best in her treatment. Now, we see another place where Carla's interaction with Dr. Toby and his eventual intervention is being carried out. Now, viewers did not appreciate an interaction of Mr. Carla and Dr. Toby prior to his visit to the palace. Prior to this visit, Dr. Toby has not been shown to have any interaction with the patient family members aside her friend, Matilda. It would have been appropriate to establish such precedents prior to such a visit. Now, the event of a near-death event in the intensive care. Now, you see, Princess Boma is seen to be defibrillated. However, viewers are unaware as to what has prompted this intervention. This is executed by the first responding doctor. He is wearing his wristwatch and it is apparent that he has not been properly guided on how to use the defibrillator, vis-a-vis the location of placement and manner of use. After administering 6 episodes of shock, the doctor examines her lower rib cage. It was unclear what he aimed to achieve, and this was unnecessary in this scenario. Her ECG parameter is flatlined except if not in use, with an oxygen saturation of 97%, which subsequently abruptly disappears. A lady one can assume to be a nurse or health assistant is seen standing behind one of the monitors. It is unclear what her presence there was meant to achieve, and such a view should have not featured in the final movie cut. Princess Boma's neck is then briefly examined for the presence of the carotid arteries. That's difficult to appreciate. Clinical death is subsequently assumed and then covered with her bedding. The diagnosis of clinical death is a grave one and should not be seen to be done in such manner that leaves room for ambiguity or error, because it then makes subsequent events in the movie to appear miraculous and not as a wrong diagnosis. Almost immediately, as the resuscitating team were about to leave her bedside, the monitor picks respiratory activity and beeping sounds from the monitor is heard while the ECG is still flatlined, which is an irony, as the patient is seen to have regained vital functions, with consciousness now fully attained. Hence, the ECG should not be flatlined. The endotracheal tube is subsequently absent, without a scene to show that she was extubated upon being diagnosed to be clinically dead. Despite the rapid sequence of events, this should have been accounted for. It is unclear why she was immediately helped into a sitting position, as this was not necessary. Whatever reason that may necessitate a sitting position, the way it was executed was not properly done. Princess Boma's recovery period is not demonstrated, neither is rehabilitation, given that the working diagnosis was narcotic overdose. A facial scar is not shown despite the apparent severity of injury and extensive plaster applied post surgery. It would have been good to demonstrate this, as this would have been the case in reality. Now, in the event of Dr. Toby's marriage to Princess Boma, there are ethical considerations that supervene a doctor patient relationship, especially one that transforms into romance, even if such feelings occurred prior to assuming care of such a patient. These ethics have important implications to educate on what circumstances this is feasible, so that the involved parties are not found on the wanting and disappointed side. Now, you see, as a doctor, it is one to tread carefully in establishing relationship with a current patient. Now, in reality, such ethical conditions would have been raised and addressed prior to the transformation of the relationship, provided certain steps was taken by both parties. So, the movie has a whole lot of medical inaccuracies and issues with medical ethics that that cause a lot of question as to why this was being illustrated in this light. So I would rate the overall level of medical accuracy of the medical content of the movie as poor and leaving room for improvement. So, what are you waiting for? Visit us today at www.positile.org.ng. Positile, quality of life, getting better.